Okay. Hello, my name is Nora Clark. Today, I'm gonna be going over osteoporosis brochure with you, if that's okay with you.
Of course.
Okay. The purpose of this assignment is just to give you some teaching about this geriatric disorder. Do you give me permission to record?
Of course.
Okay. Can you just introduce yourself? First name?
I'm Don Hamilton.
Okay. Can you tell me your date of birth?
December 2nd, long time ago, 1940.
Okay. And I just have a few questions for you before I start going over with you. I see you wear glasses. Are they prescription glasses?
Yes.
Okay. And do you have hearing aids or?
I do. I don't have them at the moment.
Okay. Well, can you hear me okay and understand me?
Yes.
Okay. Is English your primary language?
It's the only one I know.
Okay. All right. Well, I'm gonna go over briefly with you this brochure here I made. It's about osteoporosis, and it's a disorder for I won't say for geriatric patients, but some geriatric patients have this disorder. What it is a disorder where the bone mass and density breaks down, and when the mass and the density of the bone break down, the bones become brittle and weak. The normal cycle of our bones is like, it's kind of the old bones break down and then new bones are made. And this cycle kind of happens more so in your youth, whereas it's more rapid, like the making of the new bone is higher than the old bones. And as you get older, the cycle kind of changes, yeah. It breaks down more than making. And the breakdown was called resorption, and then the new bone is formation. So just plain terms, the resorption is higher than the formation of bone in older age.
Understand.
The peak of when the formation is around age 30. I'm getting there. The peak of when your bones make the most formation of bone is highest. That's how I say it. Some symptoms, signs and symptoms of osteoporosis. First thing I have is that sometimes there are really no signs and symptoms. Another thing, bone fractures. You have bone deformities, sometimes back pain, a decrease in height, kyphosis. It's like where you have that curvature of your spine, usually the top cervical spine. Some people call it humpback. And also the loss of bone density and bone mass. I guess a good way to kind of test for it is a test they call DKE that the doctors use to test the bone density. I guess they can do like bone density tests and stuff like that. So I guess if you had a history of it, you could let your doctor know about it and test for it, and then you implement interventions to kind of prevent it. Risk factors of osteoporosis. Family history, and whether you know or not, it's more prone to Caucasian or Asian females, more so than males. Aging, of course, is a sign. Having a small body frame or even obesity. Smoking, early menopause.
I didn't have that.
Sometimes your diet, if you consume a diet that's low in calcium, vitamin D, or high caffeine, if you drink a lot of coffee or Cokes or sodas with a lot of caffeine. Some medications, a few I have here is corticosteroids, Dilantin, loop diuretics, thyroid medication, or heparin. And also some comorbidities.
Heparin, the blood thinner?
Mm-hmm.
Oh, really? I didn't know that.
It can have an effect on your bones. Some comorbidities. We got renal disease, hypertension, diabetes, or thyroid disease. And it was others, but those were just a few that are, more prone. So I just put those in there. I kind of tried to look and see what particular effect they had on it, but it kind of said the research really didn't say what effect. But I'm just guessing maybe the absorption in the kidneys affects the amount of calcium in the bone, with it just building up in the kidneys if your kidneys are not producing or functioning the way they need to function. With diabetes, it's probably, I know all the hormones and the pancreas have the abnormal effects, so I guess it's all got something to do with the way the calcium is being absorbed in the bones and how the body is affecting it. I might be kind of fast talking. Do you have any questions so far?
You go right ahead. You're doing fine.
Okay. Some preventative strategies I have here. Either eat foods enriched with calcium, like leafy green vegetables, your broccoli, your lettuce, cabbage. Low fat dietary products such as your milks or cheese. Calcium fortified cereal, or even canned fish like sardines or salmon with the bones, eating the bones too. They kind of increase your calcium intake. And along with the calcium, you want to increase your vitamin D. Some people take a supplement of vitamin D, or even like out walking or something like that, getting some sunlight can help increase your vitamin D. And when you're out walking, you're getting your exercise, so that kind of helps. I did find that putting a little more stress on your bone can help with the bone formation too. So weight bearing along with strengthening exercises can help. Eliminating smoking or drinking. Wearing non-skid, slip-resistant shoes to help prevent falls, because if you fall, of course, that can cause a fracture, and the osteoporosis with the weakening of the bones, that puts you more prone to having a fracture. Do you want to look over the brochure and see if you have any questions for me about anything?
Well, do you want to know how much of this applies to me, or?
Sure. Yeah. I didn't ask how knowledgeable were you about the osteoporosis.
I don't have osteoporosis. I do have a curvature of the spine that was from birth, kind of like a birth defect,
Okay.
But it's never been enough to inhibit me or limit me in any way. But, it's just, I was born with my spine slightly curved, okay?
Like the scoliosis?
Exactly.
Okay.
Exactly. As far as osteoporosis, no, I've never had any of that. I've got a legion of health issues, but according to the VA, I was exposed to Agent Orange in Vietnam, and that has given me a lot of issues. I also lost the high part of my hearing to concussion when I was in Vietnam, so I cannot hear high sounds. I can only hear medium or low,
Okay.
But as far as the Agent Orange, what that did was, first of all, I lost a kidney to cancer and everything else around it, which the VA attributed to the exposure to Agent Orange. I have numerous cardiovascular problems, which they also attribute to that. I've had 3 bypasses. I have an artificial aortic heart valve. I have rhythm problems. I have hypertension, and so on. Again, attributable to the exposure to Agent Orange. Other than that, I do have diabetes, type 2 diabetes, which onset of that was in my 50s, I think. And the VA says, maybe, maybe not, we don't know. I probably would have gotten that anyway,
Okay. Have you had any bone fractures or anything of that sort?
No, and I've had some hard licks, but I've
Okay.
never had any problems with that,
Okay.
so.
Well, the only thing I could say is with the diabetes, if you ever thought maybe that could be a possibility, maybe you could talk to your physician about some bone density testing or something like that.
They do full work. I have excellent medical coverage, and they do full workups on me twice a year, and there's never been any issues in that area, you know. My issues have always been related. The one kidney that I have left is not fully functional, so they'll get some indicators on kidney not performing. But if you only have one, it can't perform at the level of two, so part of it is just that, you know.
Okay.
But other than the cancer, I was lucky, they got it all, it didn't come back, so
Yeah.
that's the end of that. Cardiovascular and diabetes will just be continuing things, but they're both controlled.
Good.
So I have excellent doctors, and I tend to do what they tell me to do. My diet is pretty good. I work out at the gym. I may be 75,
That's good.
but I haven't quit yet, you know.
That's good.
So,
And do you have any further questions for me?
no. Where in the world did you find such a pretty daughter? I mean, that would be my.
Well, I'm gonna end our conversation about that, and we'll talk about her. I really appreciate you. Thank you so
Thank
much.
you. Okay.